for anesthesia and pain relief for decades. The non-medical use of fentanyl has increased and decreased at various times since the 1970s. Fentanyl and its analogs have been misrepresented as other opioids, resulting in many deaths due to dosing issues. The positive effects of fentanyl include sedation, pain relief, euphoria, anxiety reduction, and general mood lift. Its negative effects can include respiratory depression, drowsiness, vomiting, nausea, constipation, sweating, and decreased blood pressure. The drug has been used for both acute and chronic pain. Because of the various administration methods that now exist, it is considered a versatile substance. For example, it can be used in a short-acting fashion for anesthesia and breakthrough pain, and it can be used in patch form for long-lasting pain relief. The drug has long been viewed as a useful substance for anesthesia due to its preservation of cardiovascular stability. It also has other useful properties like a short duration and high potency, though there are still issues that can arise in anesthetic settings. It is generally described as more sedating and pain relieving than other opioids, while also being less euphoric. Despite that, it is still sufficiently recreational for many people. Intravenous administration of fentanyl, like what is seen in hospital settings, begins working in under 2 minutes and will last for 30 to 60 minutes. With a transdermal patch, the onset can be over 12 hours, but it provides effects for 3 days. Intranasally, the drug works in 5 to 10 minutes and lasts for 1 to 3 hours. Buccally, the drug works in 10 to 15 minutes and lasts for 1 to 3 hours. Fentanyl is a phenylpiperidine opioid. It primarily functions through mu-opioid receptor agonism, and it also appears to have some serotonergic activity. Since it produces less histamine than other opioids, some of the negative effects are lower. Fentanyl is 75 to 100 times more potent than morphine, and 30 to 50 times more potent than heroin. Transdermal administration usually involves patches that contain 2.5 to 10 milligrams of fentanyl, a dose that could be lethal if taken at once. The patches provide 25 to 100 micrograms of the drug per hour, which then builds up in the skin and slowly enters the bloodstream. A light intranasal or buccal dose is 10 to 25 micrograms. A common dose is 25 to 50 micrograms, and a strong dose is 50 to 75 micrograms. Those doses apply to non-tolerant users. The amount can increase significantly in those with a tolerance. Paul Janssen of Janssen Pharmaceutica began investigating potent opioids in the 1950s, which led to dextromoramide, an opioid that was more potent than morphine. Janssen then developed fentanyl in 1960. The drug was found to be very potent relative to morphine and to have a higher therapeutic index. For situations where both significant pain relief and sedation were needed, it was determined to be a good option. Fentanyl was introduced in the US in 1968 for intravenous anesthetic applications. There was a need for cardiostable anesthetics around this time, so that operations could be done on people with severe cardiovascular disease. Morphine was tried, but fentanyl was a superior option due to it having few effects on cardiovascular function at high doses. A combo of fentanyl and droperidol, which was also developed by Janssen Pharmaceutica, was used under the name Inovar in the US and Europe. It was popular for a while, but the practice eventually faded. Non-medical use has gone in and out since the 1970s, with many deaths coming from fentanyl and its derivatives, such as alpha-methylfentanyl. Some of the earliest recreational use was by medical professionals who had access to the drug. It's been known for decades that fentanyl and its analogs could become an issue at some point due to their high potency. Gary Henderson, a pharmacology professor, noted in 1988 that it would be difficult to combat the trafficking of fentanyl derivatives like 3-methylfentanyl. Transdermal delivery was investigated in the 1980s. Duragesic, a transdermal fentanyl product, was approved by the FDA in 1990. Use had essentially been limited to hospital settings and anesthesia, but the availability of a transdermal product would eventually change that. Fentanyl prescriptions rose significantly in the 1990s, and more cases of non-medical use quickly appeared. Millions of patients have used transdermal fentanyl since its introduction. Recreational use gained more attention in the 2000s 2000s, by which point diversion was relatively common. Reports appeared of people extracting the fentanyl for injection, inhaling the drug, and taking the patches buccally and rectally. Reports also appeared of illegal production, though these cases were sporadic and regional. One of the first waves of illicit fentanyl deaths in the US occurred from 2005 to 2007. During that time, fentanyl was produced by a lab in Mexico and primarily sold as heroin. The DEA reported another significant rise in fentanyl deaths beginning in 2013, with both fentanyl and derivatives like acetylfentanyl contributing to deaths. It is now a major opioid in the illegal market, with much of the supply coming from illicit production rather than diversion. Some people are using fentanyl as their drug of choice, though that doesn't cover the majority of use. The current situation involves fentanyl, its analogs, and its precursors coming primarily from China and Mexico. The drugs may be shipped directly from China or arrive in North America through Mexico. Cartels are involved in both trafficking and the production of fentanyl opioids. Those drugs have been passed off as heroin, opioid pills like hydrocodone, and even non-opioids like alprazolam. Fentanyl is Schedule II in the US. It is also controlled in Canada, Italy, the UK, and Australia. When an accurate common dose is used, fentanyl is not notably dangerous. In fact, death is not a concern until relatively high doses are used. The problem is that fentanyl is used without people knowing they've taken it and without proper dosing. In addition to those situations, it can also be a problem if someone is prescribed fentanyl without already being opioid tolerant. Respiratory depression is a real concern with significant overdoses, which can also result in hypotension, vomiting, and increased or decreased heart rate. An exact lethal dose isn't known, though using more than a strong amount in a single dose may be an issue. Even though lethal respiratory depression may not take place, severe sedation and loss of consciousness can, which come with their own safety issues. Deaths have been reported with high transdermal application, oral use, inhalation, and injection. Seizures can be provoked with high single doses, though the amount required is above what someone would use recreationally. Serotonin syndrome is another concern, but it's primarily something to be aware of if you're being given a large amount in medical settings and are using a medication like an SSRI. Tolerance and typical opioid withdrawal will occur with consistent use. The withdrawal can be very uncomfortable. In the case of an overdose, naloxone is useful, but it is not a substitute for medical attention, nor is a single dose expected to last long enough to prevent respiratory arrest. Multiple doses could be required, and it should always be administered to buy the user some time while medical attention is on the way. Some of the risky combinations include other depressants like alcohol and benzodiazepines. If you have any
Hi there, welcome to the short and to the point video. I will cover all use fentanyl, what's the correct dose, what are possible side effects or concerns, and can you use it in pregnancy or when giving breast milk. Also made a more in-depth video. It covers everything you need to know, and you can find that one in the description. It's suitable for medical video. Feel free to subscribe and let's get into it. First, a little disclaimer: this video is meant purely informational. This is not medical advice, and if you're looking for medical advice, always contact your doctor. So, the generic name of this medication is fentanyl, but is known under several brand names, among which Abstral, Actic, Duragesic, Fentora, Aventora, Instanil, Recivit, and Pacfent. It's exactly the same substance, the same medication, but a different brands that makes it. And it's available in tablets, nose spray, and bandits. And there are some different tablets. You have a sublingual one, which means you can put it under your tongue. You have a lozenge, which takes a little bit longer for it to work, and a normal one, which is in medical terms called buccal one. Then, when do you use fentanyl? And fentanyl is used for breakthrough pains. This means you need to take other medication, maintenance treatment to create a certain level of painkiller, and then when this is insufficient on certain times, when you have pain peaks, then you take the fentanyl for the breakthrough pain. So it's commonly used in people with chronic pain that use other painkillers, experience more pain, for example, when they are changing themselves, and then they take the fentanyl. So, how do you use it? You take the tablet or the nose spray, and within an hour It will work if you take it the tablet. If you use the nose spray, it will take 5 minutes, and it will work upwards to 7 to 24 hours. And it's important to note that you do not take fentanyl on fixed times, but you only take it when you are having complaints, breakthrough, pain, and then you take the fentanyl. How long can you use it? As long as your doctor prescribes it, as long as you have severe pain, and when you use it for several weeks, then together with your doctor, maybe you make a plan to reduce the dose if possible. For safety, if you want to drive when using fentanyl, please wait 2 weeks after starting to use fentanyl, because you need to see what side effects you're experiencing. If you're experiencing any dizziness or sedative effect, then please don't drive when using fentanyl because it might be dangerous. But if you aren't experiencing those effects, then it's safe for you to drive. Please do not combine it with alcohol. This may increase the side effects you're having and therefore can be dangerous. And for food, there are no restrictions, and you can combine fentanyl with any type of food. So what would be the correct dose? If you want to use the nasal spray, you can use the dose of 50 micrograms. This is on the bottle, and you do one spray in one nostril, and if this is insufficient after 10 minutes, you can repeat it in the other nostril, again one spray. So maximally you take 100 micrograms per time, and you can do this every 6 hours when you have breakthrough pain. If you want to use the tablets, the buccal ones, start with the dose 100 micrograms, which you can go upwards to 400 if necessary. You take them, and then if this is insufficient, after 30 minutes you can take one again. So maximally you take 2 of 400 micrograms, which is 800. You can do this every 4 to 6 hours when you have breakthrough pain. And if you want to use the sublingual tablets, the ones you put under your tongue, start with the dose of 100 micrograms, but you can go upwards to 400. You take the tablet, and if it's insufficient pain relief, after 15 to 30 minutes you can take another tablet. Maximally you take 2 of 400, which again is 800 micrograms. You can do this every 6 hours. And lastly, if you want to use the lozenge ones, they only start with 200 micrograms and can go upwards to 800. So repeat after 30 minutes if you have insufficient pain release. So maximally you take 1600 micrograms. You can do this every 6 hours. Fentanyl is a very good painkiller, but it also can have side effects. So very commonly we see sedative effects, dizziness, headaches, nausea, vomiting, constipation, and some itchy. Commonly we see confusion, disorientation, migraine, weight loss or just increase, some visual disturbances, muscle pain, chills, or allergic reactions. And then uncommonly we can see any of these, so fever, coma, cough, breathlessness, high or low blood pressure, fast heartbeat, sleeping problems, diarrhea or farting. I didn't name all the side effects, there are many more, and you can find them in your prescription. If you think you might be experiencing any of those side effects, always contact your doctor to see if maybe the dose of fentanyl needs to be adapted, or maybe another painkiller is more suitable for you. If you want to use fentanyl when you're pregnant, know that this is harmful for you and your baby, may lead to addictions in the baby, and can cause side effects, and therefore it's not advised to use it while pregnant. For lactations, which is breastfeeding, fentanyl can also pass through the baby through the breast milk to the baby, and can be harmful, and therefore again it's not advised to use fentanyl when breastfeeding. So this was my short and to the point overview on the use of.
What are the side effects of fentanyl? Some of the side effects of fentanyl use are constipation, nausea, vomiting, abdominal cramps, sweating, insomnia, fatigue, drowsiness, feeling cold, headache, mood swings, changes in appetite, depression, anxiety, confusion, hallucinations, muscle spasms, tremors, and slowed heart reaction.